So we're talking about non-specific mechanical lower back pain. As I can show you on the spine here, that's pain affecting the lower part of the spine. The pain with non-specific mechanical lower back pain stays fairly central around the lower back. It does not include symptoms such as sciatica, where you get shooting pains down the legs, pins and needles, or numbness. However, you may still get some pain referring into the buttocks and the tops of the thighs. This type of pain can be very debilitating, but the pain itself is not always a sign of any serious injury or harm. The way I look at it is that the pain is acting as an early warning system around the central nervous system. It's like a primitive protective reaction from the body to stop you doing something that may cause you injury or harm. Try and maintain some level of activity. It doesn't mean that you should just carry on regardless, because the pain you'll find will limit you still. By avoiding activity, you'll often find the spine becomes stiffer, the muscles around your lower back will contract, and this often will lead to more pain. Although we can't tell you exactly what the cause of the pain is, it's often the case that there is some form of inflammatory process taking place. Inflammation takes, in its acute phase, somewhere between 24 and 48 hours to settle down, and it's during this time that you're probably going to experience the most pain. I would advise taking some relative rest. That means finding the most comfortable position and resting there. Do make sure though that you still take regular breaks from this resting position. That includes short walks, even if it's just walking around your house to make a cup of tea. Recent reports have indicated that analgesics such as paracetamol or non-steroidal anti-inflammatories such as ibuprofen have limited benefit on long-term outcomes of lower back pain. I find in these early stages though, when it's very painful, taking this type of medication can help you become more mobile. Although you can buy these types of medication over the counter, if you're thinking of taking them, it is probably worth speaking to your GP or a pharmacist first. So after the first couple of days, once you're through this acute inflammatory phase, you may still be experiencing quite a lot of pain, but it is important to become more active. Gentle movement is good for you. It keeps the joints between the vertebrae moving and helps with the blood circulation. It keeps the muscles in your lower back stretched, and it also helps to desensitize the nerves, which have become overactive, causing you more pain. With this type of back pain, the symptoms should settle within 7 to 10 days, or certainly become more comfortable. If the pain is persistent beyond this time period, it's worth seeing your GP or a physio for further advice. If you're experiencing symptoms that fall outside of this category, such as sharp pains down the legs, persistent pins and needles or numbness or weakness in the legs, once again I would suggest you see your GP or a physio for further advice. If you're experiencing persistent pain along with any other symptoms such as numbness around the genitals, an inability to pass urine or stool, then this is something much more serious, and I would advise that you seek medical attention sooner rather than later. There are exercises you can do that target the lower back to improve flexibility and help you move easier. There are separate videos for these along with advice on preventative factors and the most likely causes of low back pain on the Physio channel.